Yeah.
Hello everyone, welcome to the December edition of OverLive. I'm Runsi, the founder of Ovarcome, and with me today we have Dr. Lois Ramondetta, and she has many great topics for us to discuss. So we are going to talk about three very significant topics like palliative and supportive care in ovarian cancer. We're going to talk about spirituality and cancer, and also merits of HPV vaccination. So our guest has so much to offer that we just couldn't contain this discussion to just one topic.
We'll have to come back.
So grab a chair and join us for this conversation for the next 20 minutes or so, or 30 minutes, however long it takes. So as we talk to Dr. Ramondetta, who is a professor here at MD Anderson's Gynonc department, where she provides surgical and chemotherapy-directed patient care while also co-leading the MD Anderson HPV cancer prevention effort, as well as serving on the American Cancer Society HPV Roundtable. So as you join in, type in your name, give us a wave, a like, or a love, and let us know that you're here. And we strongly encourage comments and feedback. So if you have any questions for Dr. Ramondetta as we get into the discussion, please type in the comments section as you watch, and this is your opportunity to ask the expert real time. So please take this opportunity and ask questions and join the conversation. And remember, all questions are great, so everything is great. So thank you so much, Dr. Ramondetta, for joining us. And we have so much to discuss that I'm just going to delve right in. So
Great.
My first question is, could you tell us about the emotional and physical benefits of spiritual well-being while going through the cancer experience, and how might someone achieve spiritual empowerment, and how does it impact psychological outcomes in ovarian cancer survivors?
So we're going to do this in series over the course of the next year, right?
I think so.
because I don't think I certainly can't answer that for everyone, but I can definitely talk a little bit about that, and really just in terms of living your own life and finding peace of mind. I mean, I always joke that that's what I want for Christmas to my children. I want peace of mind. And to me, when we're talking about spiritual well-being, there are a couple of components. There's the religiosity component, but more important than that, there's really a meaning and peace component. And most of the studies that have been done that looked at spiritual well-being show that it is the mindful or peace of mind aspect of spirituality that is the most important. It's different for everybody. You come to that in different ways. We all come from different spiritual religious backgrounds. Some of that is helpful for some people, and sometimes it's harmful for some people. There are people who have thoughts about negative thoughts related to religion, and I would say that's probably the first thing that you want to get out of the way. So as an oncologist, I'm not a religious leader, I'm not a chaplain, but it is probably part of my job to triage someone, just like it is for me to triage about their pain and their social situation and their financial distress, to also make sure that there isn't spiritual distress. So for instance, there are people who come and say, I don't know what I did to deserve this. And that's a really harmful belief. And that's something that really requires an intervention, and that might be a chaplain or a religious leader, or it could mean a psychiatrist. And it's interesting, we had this conversation once about what should my response be to that, and I've always had the response of, well, you didn't do anything. But someone brought up to me once that, number one, that I've assumed a lot by saying that, and two, about what my beliefs are about what brings something on, and two, I may have stopped somebody's spiritual journey. And so a better option might be to say that in my belief system, you did nothing to deserve this. And I'd like to talk a little more about why you think that. And so I think first triaging to get the negative beliefs out. Then moving from there is, I think obtaining peace of mind is a number of different ways, but we've all talked about this in the past, that living in the moment right now is the best way to have peace of mind. Because when we're talking about what we should have done, first of all, your memories are not always so clear. My memory of the past is not your memory of the past. And so getting rid of that and being right here, and then not having anxiety about the future. So figuring out ways to live in the present moment. And that may take a couple different formats. It might take prayer. For me, it's yoga, which brings me closer to the present moment by bringing me first into my physical body and then making me pull myself out and into really a moving meditation that can pull me closer to connecting to a higher power. I think there are lots of ways to do that. I can mention a couple others. One is gratitude, and gratitude for the present moment. And some people like to use gratitude diaries. I think they can be beneficial. And part of that all is changing the way you think of things. One of the benefits of meditation and moving meditations like yoga and prayer potentially is allowing yourself to set an intention for the day and for how you will face the present moment as you move forward. And that is a not only day-to-day practice, it is a minute-to-minute practice because our mind runs away from us. And until I drew this picture once in a lecture where if you think about the way you've lived your life, you have, let's just think about a grass field. You've walked through this path repeatedly, the one that's etched in your mind about the way you respond to difficult situations, and that path is pretty well worn. And what you're trying to do is find yourself onto a different path that makes you look at things in a slightly different way. And that's really hard because the path that's worn out is so easy to walk into. And the other one is really difficult, and it requires a couple of things besides the mindfulness. It requires surrounding yourself with really positive people that can help you. One thing I want to bring attention to the readers, if you haven't already had Lorenzo Cohen on, have you?
Yes, we have.
You have. So in his book where he talks about the mix of six, one of the most important things is love and support. And so it's really hard to find peace of mind if your surroundings are not supportive of you finding that.
You know, one of the survivors that we speak with on a daily basis, she had something beautiful to say about regarding something like this. She said that, you know, we keep asking why me, but you know, I say that it's okay that it's me because I have the strength to overcome this.
Yeah.
So it's just like you said, it's a change in perspective, it's a change in how you view things and how you know, overcome things essentially. That reset is important, probably.
Reset is important and has to be done over and over and over again because there's never going to be an answer for half the things that we want to ask about why we're here on this planet. And you almost waste time. And my husband tells me this all the time. Look at all the time you wasted worrying about something that never happened. And so I think when we talk about spirituality, it's about connecting yourself to something bigger than yourself. And there's one other neat way that I like to do this is there's an app that I like to use called Remindfulness, and you can set it for however many times a day that you want to set it on, and you can put your own reminds in it. And so mine rings with a kind of a Zen garden bell, and it goes off about every 3 hours, and I'll hear it. I might have a chance to look at it depending on where I am in my day. Don't worry, I'm not scrubbing out of the OR to look at it. And it just gives me a sense to take a moment and step back from whatever's happening right now. Take a deep breath, recenter yourself. And there are some yogi ways that you can do that. I mean, one of them is just connecting with your breath. And not just like I'm breathing, but I'm breathing and I can feel the air coming in past the nose hairs. I can feel my nostrils opening and then it's going in and filling my lungs. And then I'm letting it out. And then it's also kind of a physical stance that you take. You can sit in a chair like this, or you can sit in a chair like this. We have something in the yoga that I do called Finding Your True North. And it's a simple thing to do. I don't know if I stand up if I'll be out of it, but when you're just standing, let me stand for a minute, but when you're just standing, you can kind of be in this I'm just standing, there's no interaction with me and what's happening, but if you think about pressing into the floor, and you think about opening your chest and standing a little bit taller, you feel a little bit more empowered and a little bit more able to face your next situation. So that's not really spirituality, but it is kind of finding that first little aspect of peace of mind, taking you out of the future and taking yourself out of the past and trying to land yourself right here. And it is hard. It is hard. It's hard for me. There's one other thing that I want to mention that I've kind of learned through some of my training is just the shoulda, coulda, wouldas, and getting rid of those and trying to recognize that those, you can name them and say, we have a trick in my yoga training where we actually name that person who's telling us the shoulda, coulda, wouldas. Just pick a name from somebody in your past and you're like, thank you for doing a good job, Renee, if that's your name. That was our name. Thank you for doing a great job on keeping me reminding of what you think I should be doing. Now go back into your room and go away. Yeah. And so the mindfulness aspect is that you recognized it was that voice talking, and you didn't let it get away from you. And I know that what I'm saying is not going to land with everybody, because how we define spirituality is very different for all of us. But to me, it is being connected to something bigger than myself through the work that I do, for recognizing the beauty around me and trying to stay grounded in the present moment. And so that's one more little aside on that has to do with mindfulness, is that when you have something happen to you, like that voice talking to you, or a pain, to try not to name and describe it, to more step back and say, I feel something. Let me get curious about that. Let me think about how I'm going to breathe through that, and not think, for instance, I have this pain here, and oh my God, does that mean my cancer's growing? Does that mean it's not? And if you've got to think something, think it's the chemo working on the cancer. I mean, think something. So changing the way you think about things, because there is the power of suggestion, and I'm not saying that you can make yourself better. Definitely you need partnership of doctors and medicine. On the other hand, I think you can make yourself worse. I do think that's true. I think that you can, even if your depression does nothing more than kind of leave you in a sad state where you don't appreciate the present moment, and it drives you farther away from the people that are supportive of you, then you think you can do yourself some harm, unless you're wasting precious time. Is that an answer to?
Fabulous. That's a fabulous answer. Thank you so very much. And just switching gears a little bit, we recently shared a research study, this was a couple of days ago, that involves about 280,000 people across North America and Europe. And that talks about that there is no correlation between work stress and ovarian cancer. Yet we know that it has been substantiated, right? That there is some impact on ovarian cancer as far as stress. So could you clarify how stress might impact ovarian cancer and some of the ways we can address it?
So a couple of things. One, as somebody who's interested in this topic of stress and finding peace of mind, I am continuously frustrated with how difficult it is to prove anything about those things. One of the interesting things about Western medicine is that we've done amazing things by surgery and trauma and immediate physical things that we can do, and yet we also try to describe what's happening to us with very clear, the tumor shrunk by 20% because I gave this drug and it worked for 3 months. And you can publish a paper on that, and you can do that, and yet I think we missed probably everything that we just talked about for the last few minutes. Stress is one of those things that's difficult to measure. However, it's a very interesting topic, and this study was specifically about work-related stress, and I'm thinking probably most of the people on here also know that your partner-related stress can be one of the most difficult things, or financial stress, or stress can be measured in so many different ways, and that's the problem. I mean, how do you get the right survey to really ask those questions? The reason I'm interested in that is a lot of Anil Sood's work, and looking at really in a mouse model what happened when you were able to physically stress mice. And I know you've probably had him on this before, but the concept is essentially, and you can use a beta blocker, or maybe you could use yoga. it's hard to get the mouse to do yoga, but but you could do something to reduce that flight response that you get. And so everybody's talked about this, that having a flight response is great. It gets you up and moving and gets you out of the way of the lion from before, or maybe even gets you to say, I'm going to beat this, and gets you out there. Now when it becomes a chronic stress though, you're turned on all the time, and that definitely wears on you and does some basic biochemical things. And one of the things that we know that it does is it raises your norepinephrine and your epinephrine. It changes some interleukins that show a little bit more stress, and it also can affect VEGF, which is the vascular endothelial growth factor, which is the major target of bevacizumab. So I think that it'd be hard to measure someone's stress. Perhaps their work isn't their issue. Perhaps it's their child who is still trying to figure out what she wants to do with her life. Perhaps it's something like that. And so I everybody's different, just like we talked about spirituality, what affects people differently is that. And even as we reflect back on the mix of six, your social support is a huge aspect. And I would also say finding meaning in your work. So going back to how you would find peace and lack of stress would be those things. Social support, good sleep, eating healthy, recognizing some amount of control over your situation, that you have the control to, one, ask questions. When you feel like a pain medication isn't working, don't not come back, come back. When you feel like your approval from your insurance agency didn't go through, don't wait till your next visit to come back and tell us. Really take some degree of control, because there may be a solution that can help you. So again, that and
just being proactive.
Being proactive, not to the point that you're making yourself crazy, but living in the moment and saying, I have this issue, and I want to solve this issue.
Just recognizing the sources of stress in itself is a good exercise, essentially, right?
Yeah.
To get to the solution.
Yeah. So again, I had a friend who used to talk about AC and BC friends, and she had friends that she said were her before cancer friends, and friends that she called them the after cancer friends. And it's about making your situation right for you, and that means getting rid of past regrets and future anxieties. That means living in the present moment. That means taking control physically of yourself as best that you can. And we're going to talk about supportive care, but involving them earlier as a way to empower yourself physically, so that you can, mentally and physically, be your own best advocate, and sleep and exercise and diet. So do I think stress affects cancer negatively? Yes, I do. And
it's interesting that they could actually segregate the work-related stress with other stressors. I mean, it's just a little strange.
It is strange, yeah. And I don't know that I can comment much more on their particular way of doing it, but there's definitely evidence in animals that you change the chemical makeup of your body by stressing them. It's hard to mentally stress a mouse, but you probably do mentally stress them. The way Anil's lab did it was they're kind of in these chambers for some small portion of their day where they can only move forward and backwards, and they're not around their friends, and they're not able to eat when they want. And you definitely see the changes that we're developing targeted drugs to combat.
That particular thing. Okay. And so, as you mentioned, we will talk about palliative care as well, and we know that it's a largely patient-centered approach, right? And so what should our survivors and family or friends know about this supportive care, and at what juncture then should the discussion transition into hospice care, and how does, again, tying it all back to the spiritual well-being, how does all this, like spiritual well-being, empower and impact these decisions in women with ovarian cancer?
So I'm going to separate some things out, that just to clarify that palliative care is not hospice care, that it's, and in fact, there had to be a name change here at MD Anderson because it was considered such a negative thing. It became the supportive care group. And ASCO, the American Society of Clinical Oncology, recommends that anyone with metastatic or advanced cancers have supportive care involved very early in their treatment. Not to prepare them for when they're stopping treatment, but to make them the best that they can be at the time. And there's a science to constipation and abdominal pain, and how do you balance pain control and fatigue and exhaustion from the drugs, and how maybe to also, I'm going to add in integrative medicine as a form of supportive care, where there are things that you can do to put yourself in the very strongest mentally and physically positioned so that you can get the treatment that we're recommending. So I'd say early on, if you have advanced, unfortunately, as we know, ovarian cancer presents as stage 3 most of the time, and those patients already have a lot of symptoms. Diet is a huge aspect because your food doesn't move through smoothly. So how do you, we used to just say, well, eat 6 small meals a day instead of 3 big ones because you can't eat so much. But there are potentially foods that you could change, and we have great integrative medicine here that I usually send patients to one of the doctors in particular to talk about dietary changes, especially with people who have a low-grade bowel obstruction. So early on is when you get supportive care involved, when you have an advanced cancer. I would say another aspect of supportive care is psychology. And so if you are having trouble staying in the present moment and coping with your situation, get them involved early. You're trying to live your best life now. Another time point, other than diagnosis, is when you're thinking about a clinical trial, and oftentimes you've already gone through the first couple of cycles or series of cycles, and you may not be feeling as good as you did even when you started, because both the treatments and the cancer are wearing on your well-being. And so I usually think of another referral to supportive care, because I get 2 types of patients here. I get either upfront patients or patients who are here after heavily pretreated elsewhere who come in for a second opinion. And in those patients, I feel like they should automatically be set up to see me and supportive care, because many places don't have a supportive care group within their institution, or their institution hasn't had the culture shift to understand that it's a very important early aspect of care. So supportive care getting involved at that time when you're trying to tune somebody up for a clinical trial. So there are, much about performance status is when we see a patient, we look at what their performance status is. And really, if you spend more than half of your time in a chair or in bed, we consider you a PS of 3. And in those cases, you're not eligible for a clinical trial. So having supportive care get involved to potentially help manage your neuropathy, your fatigue, maybe your sleep, your emotional stress, so that you can get to be a 2 or a 1, so that you could try a clinical trial if you wanted. And then it's always a difficult idea. I don't like to think of it as a transition, because I hope that they've been my partner in the care of my patients all the way through. But at some point, there is no further active treatment against the cancer, and only support given to the patient. And in those cases, the supportive care doctors, that's their specialty. That's what they're good at. It's a hard thing to part from a patient who may switch over to becoming primarily a supportive care managed or hospice managed. And there's not a right answer for when that occurs. It is hopefully a decision that is not made suddenly, but one that has been discussed ever since very advanced disease or recurrence, where each time someone comes back with a recurrence, you're weighing the benefit of giving them a new treatment again, and the possibility that it'll work, versus the chance it's going to hurt them. I just had something, I had a very sad thing happen with a patient earlier today. So the worst thing that we can do is, I was emotional about it earlier, the worst thing that we can do is hurt them with our treatment. And so you want to give them the best chance to do as good as they can. But if you can't, it's important that you're honest with them, because the worst thing that could happen to somebody is that you take away that time that they have left. So,
and this I understand this very well, because in my mom's case too, I mean, she told me in the end that, I just don't want any more treatment. Just let me go gracefully. And that was her wish, and we granted it. So it's important to listen to the patient and, and understand where they are coming from.
Yeah, and you just brought up, I'm so glad she told you that, because it's such a difficult situation when you have, because sometimes nobody wants to say it.
Mm-hmm.
The patient doesn't want to say it because she doesn't want her children to think she's giving up, and it's not giving up, because we're all going to die.
Yeah.
And the patient's kids or spouse or parents don't want to say it because they don't want to think that they are abandoning them. But I'd say almost every time when you're in that situation, everybody already is thinking the same thing. There's occasional times when they don't. So I think facilitating that openness, and I usually say even at just about every recurrence that this is how we're going to do it. We're going to try these next few things, and each step of the way we'll decide what the benefit is for you. We're going to assess after 2, 3, 4 cycles, and if it's working and I'm not hurting you, then we'll keep going. And if at any point you feel that you're exhausted and you need a break, and that might mean, yes, you're supposed to give Doxil every 4 weeks, but if you want a break, there's nothing wrong with it to take a little bit longer time.
I think the voice of the patient is very important. Survivors have, they need to be heard, essentially, on the whole treatment process. So thank you for that. And again, this is such an important topic. It's a topic by itself, right? As we talked about HPV vaccination. So I feel very strongly about this, and I want to know from an expert like you, this really prevents cancer, right? HPV vaccinations prevent cancer. That's the bold and big line. However, we are still struggling with the percentages of, the people, actually the children getting the vaccinations and all that. So I just wanted you to talk to our audience about, the benefits of HPV
So
vaccination.
switching gears to prevention.
Absolutely. And, and what types of cancers, because there's a not everyone knows that it's beyond cervical cancer. There are many other kinds of cancers that are impacted. And then, so basically, what are the benefits? What types of cancers it protects from? And there are some recent changes to the guidelines in the vaccination. So if you could please share with us.
Well, this is an easier topic for me. So the HPV vaccine, and there's only one in the U.S. that's marketed right now, not because the others aren't good, but because this one's probably the best, protects against 9 different subtypes of HPV. And there are hundreds of different types, but we know that only a few cause cancer.
Sure.
So there's probably somewhere in the range of 15 to 20 that are really cancer causing, but if you look at the ones that cause it, 2 in particular cause almost all the HPV related cancers, and we call them HPV 16 and HPV 18. HPV 6 and 11 cause genital warts and potentially mouth warts, and they also cause something called juvenile recurrent respiratory papillomatosis, which is obtained through the birth canal. It happens on the vocal cords, and it's recurrent papules that happen in infants, and they can have up to 11 surgeries during their lifetime to resect these because it can affect their airway. The cancers that HPV prevent is cervix, and using the HPV 9, it should prevent up to 85 to 90% of all cervix cancers. Anal cancer is almost always caused by HPV 16, so 90% of anal cancers. Vulvar cancer, about 50-60% of them. There are some other causes. Vaginal cancer, penile cancer. And then the one that is actually outnumbering all other HPV cancers at this point is oral pharyngeal cancer. And I always say it's the wrong side of the body for me, so I had to kind of research it a little bit, but it's kind of right in here. And there's a lot of structures in there, but the 2 that are related to HPV cancers are your tonsils and the back of your tongue. And the people who get those cancers are usually 55-year-old men, although women can get it as well. We're not really sure why men get it more, but we think it has something to do with some natural immunity that women may have that helps them clear it from their mouth better. People who are immunosuppressed are at more risk, but the average person that gets these or is not immunosuppressed, usually, we usually describe them as higher socioeconomic status, Caucasian 55-year-old men. And we don't know why, except that we can think of it like this. Cervix cancer is definitely HPV related, and though we have a screening test for it. So if everybody got screened the way they were supposed to, and they got their vaccine, we might be, we are aiming to eliminate it. There is no screening test for this. You can test for HPV in your mouth, but we don't know what that means. Probably 5 to 15% of the population has HPV in their mouth at any one time. And so we don't know what to do with that information. There is no FDA approved test for that. And so it's not associated with socioeconomic status. This is because lack of insurance is associated with that. So 70% of the cancers in here are caused by HPV. We think that almost, and now tonsillar and back of the tongue, it's most of them. And it's an epidemic. We're seeing it rise by 3 to 5% per year in the United States. And it is, at this point, more oropharyngeal cancers than cervix. But remembering that about 70% of those are what's related to HPV, probably about even. By 2020, it'll be the most common.
And for just from what I read, for our international audience as well, that cervical cancer, there are like 500,000 cases a year worldwide. That is huge.
Yes. Yep. And 25% of them come from India, and definitely South America, and Africa, because there's rural areas and less access to pap smears. So vaccination would be great. We have 4,000 deaths per year in the U.S. related to cervix cancer alone. We expect that if we were able to vaccinate and do the screening where we have it, we would probably be able to prevent 28 to 30,000 deaths in the U.S. alone. Probably for cervix, it's somewhere around 250,000 deaths. And so there's just, it's actually 5% of the world's cancer population with just the vaccine. So who is it supposed to get it?
Yeah, and so on that note, we have survivors that are listening in that are also young moms, and they have children, like teenagers or between 9 and 26. So tell us.
Yes, let me stress: you do not have to have intercourse to get HPV. You can get it through kissing; it's in the mouth. You can get it through digital touching. You can get it through oral sex, and you can get it through intercourse. And you do not have to have anal intercourse to get anal cancer, because everything down there has HPV on it. And so who should get vaccinated? It is a prevention-only vaccine. You want to give it before they've been exposed. And so who is that? I mean, I have a 12-year-old and a 21-year-old. You definitely want to catch them before they get intimate in any way with anyone. And so you want to give it to them when they're in the 9, 10, 11, 12 range.
Right.
Not saying that your kid's going to be active after that, but this is prevention only. And let's say they get it through kissing or touching or exploring. The other thing I have to say is if you guys can control what your kids do, please also can you write something on the Facebook notes and tell me how to do that, because I definitely can't affect what my kid does. I know I can't affect what my kids' partners do, and you can only hope that your kid will have an intimate relationship with somebody at some point in their life. They may actually have their high school sweetheart, and they've been together only with each other, never kissed anyone else. And then when they turn 30, something happens, widowed or divorced or something, and they're going back out. Protect them now. It does not work well when you get it later. So again, when do you get it? 11 and 12. When you get your Tdap and your meninge, that's when you want to give it. Now, the FDA, the American College of Immunization Practice recommends that we give it to all 11, 12-year-olds when they get their other vaccines. If they get it before they turn 15, they only need 2 shots, unless they're HIV positive, but 2 shots. Even if you get it on the day before your 15th birthday, you only need 2 shots, 6 months apart. If you're 15 or older, you need 3 shots, or if you're immunosuppressed for any reason, rheumatoid arthritis, chronic steroids, transplant, HIV, anything like that. The FDA on October 5th approved it based on efficacy and safety up to the age of 45, because there's data that it can help, not as good, but can also work to prevent cervical and anal dysplasia in women and men up to age 45. In February, the ACIP will take that information, knowing that it's safe and efficacious, and kind of say, is it worth our funding? Will we prevent a lot more cancers by vaccinating from 26 to 45? Is it worth it for us to pay for that? Because once ACIP recommends it, it becomes covered by your insurance company.
Right.
There are some insurances who are covering it now, but yours may not. So one, do it when you're supposed to.
Right.
Anything after 11, 12 is starting to be late. If you're 13, 14, 15, you're late. And you as a doctor and you as a parent didn't do everything, in my opinion, did not do everything you needed to do to protect your kids.
And I'll share my personal experience, because one thing is also very important, that it's not if you have a girl only, right? It's also for the boys
to protect
so
themselves.
I have two boys, and my older, as soon as he turned 11 for his the shot appointment, I took him and I made sure that he had all the 2 shots, and it's just like any other shot, right? I mean, so there was no side effect, there was no nothing, and it was just, and I didn't even
hurts
honestly.
a little, you get a little red.
Just like any other immunization.
And if you're really worked up, you might faint. So
well, they made him lie down for 15 minutes. Yeah, that's what
adolescents
happened.
have fainted after
he was
vaccines.
totally fine. But the thing is, the point that I want to stress is, like you said, early is better, because you don't have to explain that much to your children.
You shouldn't be explaining anything. There should be no discussion. You're getting 3 vaccines to prevent disease later in life.
There are no side effects. It's just like any other immunization, and that it can protect you from 9 different types of cancer.
There's extensive studies on the safety of the HPV vaccine. Yes, they're extensive, and I like to use, I usually give this explanation for people who are listening, because I'm glad you guys are all listening on Facebook right now and you're getting good information. However, please don't listen to Facebook all the time. That's the PSA. So there is some information that floats out there about why vaccines are bad. There's actually a great video, I can give you the link to it, from the CDC on how a vaccine comes to be. It's only a 4-minute video of essentially what a vaccine has to go to before it goes to people. There's also this great system that we have called the Vaccine Adverse Event Reporting System, which records anything bad that happens after a vaccine. And it's a bunch of raw data that someone then needs to sit down and say, oh, look, there is some, let's say soreness. Everybody who gets this vaccine has soreness in their arm, and let's look at the correlation. Did it occur right after? Did it occur 10 years later? When did it occur? Our system is really good. So years ago, there was an oral rotavirus vaccine that they used to give, and it was tested, but they tested in certain tens of thousands of people, and then they released it. And within 8 months of that vaccine being out, they recognized that there was a trigger point that occurred in infants in their intestinal system. It was an oral vaccine. It made a lymph node get big, and that caused what's called intussusception, where the bowel kind of collapsed on itself, and the kids required surgery, and they pulled it within 8 to 9 months. HPV has been FDA approved and out on the market since 2006. Worldwide, there's about 300 million doses that have been given. It's been tested extensively. Anytime anybody has a concern, they go back to this data and they say, let's look. Let's say chronic regional pain is something that somebody has suggested. Does this correlate with the vaccine? And it doesn't. There's a difference to say, yes, we see girls in that same age group get this problem, to saying that it's related to that.
Right.
So it's about causation, and it takes somebody sitting down with the data. Because technically, if you get your HPV vaccine, fall and hit your head on the ground, and you end up with a concussion, that will be reported to theirs. So why did that happen? Well, maybe it's because the kid was really anxious and tripped and fell and hit his head, and you need somebody to sit down and do that. I'm glad you're on Facebook, but I really highly recommend that you keep your sources too.
We are with an expert, so our sources are great at this point. And so, just a quick question on that, as we are discussing on HPV. So for women who have been diagnosed with ovarian cancer, are there any chances of developing cervical cancer as a secondary, cancer? And if so, would you recommend for the younger patients, for the latest guidelines, that they take the HPV vaccine to protect them from the secondary cancer, or is there no correlation?
Oh, there's no correlation. Except for the fact that you're a human being, and 80 to 90% of human beings get exposed to HPV. Also, most of the time you've had a hysterectomy, so your cervix is out, which is good. Could you get two cancers? You could. You'd be, it'd be very sad. So that said, I would say stick with the ACIP recommendations. If you're between the ages of 9 and 26 and you have not been vaccinated, get vaccinated. If you're over 26, I would wait until February, March when the ACIP makes a recommendation. And if you're over 26 and under 45 and the ACIP recommendation changes, then yes, I would get vaccinated. There is no, most ovarian is spontaneous, although there's about 20% is genetically related. At this point, there is no family of HPV cancers. There may someday be a way, wouldn't that be great if we could say, oh, we know that this person based on their HLA type or something else is at risk for getting an HPV cancer, but at this point, there is no family association with it.
Okay.
So, yeah. So just as a member of the human race who's going to be exposed to HPV, unless you're very unusual, that you're going to be exposed, so protect yourself.
Okay, fantastic. My last question, because, this is an important, we talked about a lot of stuff, a lot of great, important topics. And so my last, question to you is, when it comes to ovarian cancer awareness and, just thriving through survivorship, what would be your message to our audience? Our survivors that are listening, or the family members, caregivers that might be listening in now or later. What would you tell them?
Okay, lots of things. I would say the mix of 6. Number 1, read Lorenzo's book. I think that's great, Lorenzo and Allison. And then keep communications open, both with your family and your physician, your caregiver, your advanced practice nurse, whoever it is, to make sure that you are honest with them when you're struggling emotionally or physically, to gather information as you can. I have many patients who come and ask about clinical trials but don't really understand what a clinical trial is, to know that you always have options, to stay in the present moment, to do it right now, whoever's listening, to sit and stand in a way that's powerful for you, not a fake one, but to sit a little stronger and feel the chair or feel the floor pressing back up against you, and stand in a way that is going to allow you to approach things from an empowered way. To take moments out of your day to appreciate what you see in front of you, to recognize, it's not, it is different, but I'm going to think of it like just somebody who doesn't have cancer. I remember when I was going through medical school and college saying to my dad, I just want to live my life. And he's like, this is your life. And it was kind of it was a wake-up call to some extent, saying, he's right, this is not like going to get somewhere else. This is about right now. And I always reference on anything like this Viktor Frankl's book, A Man's Search for Meaning, and if people haven't read it, I highly recommend it as a book for life. You could take it in a small way, and I don't remember this, and people who, there may be friends of mine who are watching this like, what are you talking about? It's a daily practice, and I'm working on it, and I'm so much better than I used to be at getting myself back to the present moment, but it is about the attitude that you take towards the present moment. And I even might have written it on my body somewhere, but that I have a choice on how I respond to things. And sometimes I make bad choices. As long as I'm aware that that I'm making a bad choice and I'm choosing to do that, well, then that's my prerogative. But the majority of the time, I have a choice on the way I respond to everything that happens to me. And then I don't need to pick every battle. And that might mean with a BC friend, you might not need to. So resetting how you look at things, being genuinely curious about why things are happening, remembering that when someone's giving you feedback, instead of getting angry, to try and sit there and say, I wonder why this is happening, and what can I say to understand this a little bit better. and then go to yoga every day. So
That's perfect. Thank you so very
You're
much.
welcome.
And this was a great discussion. And
Yeah.
so
I'd love to see what people wrote or
and
hear
so
some feedback.
we also get a lot of views afterwards when we post the video. So I'm sure there will be more comments and feedback coming in. So this is, for those that are watching, this is a book that Dr. Ramondetta wrote about 10 years
Co-wrote.
ago.
Yeah, let me just say one or two words about that. She, Deborah Sills, had ovarian cancer. She's also a world religions professor, and I met her when I was in training here. And just one of those people, just as an example, the first day that I met her, well, actually, we talked about, well, one of the first days I met her was post-operative she had a huge bowel obstruction, and there was a lot of adhesions. She had an NG tube in her nose, and I went in at like 5 in the morning and said, "Hi, how are you?" And she's like, "I'm great." And you just knew that she was a different kind of person. Anyway, we worked through me becoming a doctor and going through some difficult emotional changes in my own life, and her dealing with cancer, and we wrote about it together. So the book is half written by me, half written by her. She did die eventually from ovarian cancer, and we finished the book while she was on hospice, and her daughter and her husband helped me finish it. It's 10 years since we did that.
Congratulations.
Thank you. And it was a really one thing that journaling your thoughts, getting them out of your head onto a piece of paper was very helpful for both of us.
So this is a very beautiful collaboration. So thank you for sharing this book with us. And for those of you that might be watching, do not forget to leave your name in the comment section for a chance to win this book. We'll get it signed by Dr. Ramondetta, so we can, and it's anywhere in the U.S. We'll ship it to you. This is called Extraordinary Friendship of a Doctor and a Patient, Brought Together by Cancer. It's a beautiful book, and so again, if you are watching, do leave your name and comments in the comment section so that we can reach out to you if you win. And so from all of us at Ovarcome, we wish you the happiest of holidays.
Happy holidays.
See you again next year. And meanwhile, keep talking about ovarian cancer, because as we know, together we can overcome. Thank you so much.